Okay, welcome back to Daybreak. It is time for your health check. A new COVID booster is available for children. I asked the chief of infectious diseases at Children's Health whether kids really need it and why. Here's what he told me. Over the last several weeks, a third of the COVID cases locally have been in school-age children. And that makes sense because kids are back in classrooms, congregating in close quarters, and these are ideal conditions for the virus to spread. And not as many children are being hospitalized as with the first major Omicron wave, but BA4 and BA5 are still circulating as the primary variants right now. And Dr. Khan says this newly available booster can help to prevent severe disease.
This is a bivalent vaccine. It has sort of the index or ancestral strain, the first one that entered the population. And now it has a second strain, which is sort of a combination of BA4, BA5. But if a new variant were to emerge, I suspect we're going to see a same pattern that we saw previously. New variants emerge, the vaccine works against these new variants to some degree. And those who haven't been vaccinated are really at a much higher risk for severe disease.
Okay, so when would you get your child this booster? So if they've recently had COVID, the CDC recommends waiting 2 to 3 months after that natural infection. If they've received their 2-dose series of either Pfizer or Moderna, it can get confusing based on their age, their health conditions, and other variables. So the CDC has something called a booster calculator. That's online. All you need to do is plug in your child's info. You can do it for yourself too. And it'll recommend when to get them a booster. By the way, we are coming up on flu season. Dr. Khan says you can get your child the flu vaccine at the same time as a COVID vaccine or booster.